please join me in welcoming the Community Health Improvement Grant Program. With me right now is Doug Baxter-Jenkins. Great name.
Thank you.
Wow. Region Director of Community Health at Virginia Mason Franciscan Health. Welcome to Cityline.
Thank you.
Good to have you here. Next to you is Dr. Sierra Oslin. You are the Director of MH and SUD Services. Welcome to Cityline. Great to have you here. And rounding out the couch, it's been years since I've seen you. Roxy Magno, you are the Director of Outreach Services for Virginia Mason Franciscan Health. Welcome back to Cityline.
Good to see you.
Good to see you. All right, let's get into this because this is such good news. So, Doug, tell us about Community Health Improvement Grants. What do we need to know to understand them?
Sure. So the Community Health Improvement Grants are a way for us to invest in the great organizations in the Puget Sound region that just need a little extra support and funding to expand their programs. So us as a health system, we gave out $1.78 million in grants this last year to 27 organizations. The collaborative projects focus around access to healthcare services, behavioral health, violence prevention, and chronic disease prevention. Things we know with data are needs in our area. And just in the Tacoma area, it was over $750,000 of funding that went to organizations like Multicultural Child and Family Hope Center,
Yes,
doing amazing things for our neighbors.
which Roxy is connected to for people at home who don't know that, yes. So when we think about how they relate to the mission and vision of the hospital system, because sometimes when you get out into the community, we get what we call mission drift. But I can tell by the look in your eyes, all of your eyes, that has not happened. So how does it relate to the mission and vision?
Sure. Our hospital system was formed over 130 years ago with the express goal of increasing care for those who are vulnerable. Who is left out of the system, who needs help. That's why we were started. And that mission carries with us today. Our mission statement includes working for those who are vulnerable and advancing social justice. This grants program is a way that we put that mission off of a piece of paper or a poster and into action on behalf of our communities.
Oh, I love that. So how do we measure if these grants, Doug, are effective or if they are something that has not landed where it should?
Every grantee tells us that they get to measure their own success. So they tell us if this project over the course of a year is successful, they tell us what the outcome measurements are going to be. We ask for measurements at the 6-month mark at the end of a year.
Wow.
So we know that these programs are effective. We know that they are serving those that they are intended to serve and that they're reducing health disparities, which is the most important part, that it's actually having the impact on those who need it the most in our community.
Absolutely. And this is, I want to say, this is so timely given what's happening in our nation right now and the cuts that have happened and the cuts that may be happening. We are finding our most vulnerable right now are having that health care net taken away from them. So it is so wonderful that the generosity of this program is getting to the people who need it the most. Dr. Oslin, when we talk about the funds, how have they helped you specifically?
Yeah, so they have helped our organization expand equitable access to resources, particularly folks who cannot afford a traditional SUD assessment rate or a mental health eval. This might be an additional barrier in terms of housing, employment, getting their children back, getting clean and sober.
Yeah.
A lot of those fees are barriers for folks in the community who can't afford it, right? So on the low end, you might see an SUD assessment range $350 per hour all the way up to $1,200. We also have been able to expand some of our court-ordered services. Traditionally, anger management that's court-ordered is a substantial fee, and with this grant, we've been able to provide equitable and free access to folks in our community who are in recovery. the thing with recovery is you could be recovering from many things in your life. It doesn't have to just be, a substance misuse. It could be housing. It could be, recovering from losing your children.
Right.
The list can go on. So this grant has helped us be creative with how we are able to provide those resources to members in our community from a culturally and respective way.
And I want to say something here. Grants oftentimes don't cover this, and I see Roxy nodding her head because of your background with the Multi-Child and Family Hope Center. Those issues that you described, Dr. Oslin, they walk in the door. And sometimes it takes forever to get to the reason why those issues are, because you only have maybe an hour, maybe 3 minutes at the most. But over time, those issues will show up in just people's daily living. How forward-thinking of this program to be able to see beyond what's behind the curtain.
Right.
That's impressive. So, Roxy, what impacts have you seen and given what you do?
Yeah, a lot of impacts have shown through this funding. How Doug spoke on it was, we receive unrestricted funds essentially for the work that we do. And when we do the work that we do at Multicultural, we're not siloed in how we do the wraparound services. So when Sierra mentioned that recovery is anything, so we were able to wrap around our people with how we need to. And when we kind of get to sit in the front seat and guide how these funds need to be used, that is instrumental with actually being able to serve our community. When you put the person back in their own driver's seat, you see so much trajectory change.
Oh, you do.
Right?
Yes.
And because they were a part of it, they got to be the driver. And then we just get to we're blessed to be a part of it. I always tell people, I'm just lucky to be a part of your life now. And so we get to be creative and decide with them, not for them, because it had to fit into the way a grant has to look. We get to do it how they need it.
Oh my God, my face hurts from smiling. Because this is exactly what we need. We need to look at the whole person, not just what the grant says that they need, or the demographic, or what boxes they check when they fill out government forms. This needs to be what it is. That is so incredible. So, when you think about how important these funds are, Roxy, what is the sense of protecting if they go away?
Yeah. Multicultural is really known for once we start something, it doesn't go away because funding does, but also puts nonprofits in a really certain kind of position when it comes to that, because the community relies on us so much for the things that we do. And for so long, we've done things unfunded because it was just what was needed. And we are facing a really harsh reality of we don't know how some of our programs that have really healed and brought families back together and kept families together, brought people into recovery, what that's going to look like. And so being able to receive types of funds like this, being supported by really large entities, I think we're spearheading ways of we've been gearing up for this time, right? We're okay. We're going to be okay. Everyone's going to be okay.
I love this.
Right?
You've done the homework.
Yeah.
Absolutely. Dr. Oslin, when we think about what you are most proud of, what comes to mind?
I think being blessed with the opportunity to carry the legacy with our founders, so our executive director, Gail Neal, her mother, Cora, and our former ED who has passed away from the Tacoma Recovery Center, Ann Artman, being able to continue her legacy in this work. I know that she'd be so proud, smiling from heaven.
You bet.
And anybody who has made a generous contribution to our organization to help these projects to continue to grow and thrive and heal people in our community.
Absolutely.
So
Doug,
big thank you to everyone.
I love that. Last word. In 10 years, what's the one thing you want people to walk away with? Give me one word.
I work for an organization that cares.
Right.
And we are investing in community infrastructure.
There we go.
That can last beyond a grant, that can last beyond any of our time in our respective organizations.
So on that note, with that beautiful goodbye, I'm not going to say anything more except thank you to all three of you.
Thank you.
For the wings that you have on, for the people behind you that we couldn't get on the couch, and for all the good that you're doing for our city. I would love to have you back on soon. Thank you so much.
Thank you.
Thank you.
We have much more to come on City Line. Don't go away. We'll be right back.